So, boa tarde. This is my Portuguese also. I was thinking on doing in Portuñol, but you know it's going to be difficult to understand, so we are going to move to English. Glenn, I've been looking to say good afternoon in Norwegian, but I don't know how to say that, so sorry for that. I'm Rafa Prieto, I'm an occupational therapist and postdoctoral researcher in the University of Almería, but today I'm going to talk about the project I did in my PhD. It was in the University of Granada. I always... Spanish, you know, this is Spain. This is Spain. Okay, I will try. If not, you do that. You do like this. Thank you, Georgina. So I met Ricardo the last year because he was my PhD opponent. It was amazing, the process of being with him, and I have to say thank you for you because you have been pushing to put the ActiveHip Plus here in Portugal, and I'm going to show you after, during the presentation, this project. I wanted to make a little bit a quiz because with you, but the point is I'm discovering your system is much different than mine one, so maybe you are going to discover how we work in Spain more than I'm going to discover how do you work. But I want to start with this question, so please, I'm not going to read the question because all of you know to read. Please take your cards. What do you think?
And raise the hand high.
Yeah, I'm looking for a red card. Blue. I have to say that Glenn have made a spoiler about this. It was in your slides. So we have blue, we have red, some greens. So it's a premium for the one in green. It's 1 out of 4. 25% of the people with a hip fracture die in the first year. This is the second one. This is more related to my work because I'm an occupational therapist. I know this is going to be some kind of different to the talks. So what do you think? Do you understand the question? How many other people recover their previous functional level? I mean, to be able to have a shower, to eat something independent.
Do not recover.
Yeah, do not recover, yeah. We have blue, we have green. Nice, it's blue, okay? Between 60 and 80% of these people are not able to live independently.
Rafa, this is in Spain or global?
This is globally. Supposed to be globally. You know, papers are papers because, for example, in the scope, I really like that document, but they say that in Spain we have a lot of resources for osteoporosis. Nothing to say. We're not going to say nothing because we are recording, but... Okay, so what do you think about this? When should I start the rehabilitation after a hip fracture? Red, red, blue. We have red or blue? Red. But do you think we meet this? Please raise your hand if you think that we are meeting this point. Do you think that the rehabilitation starts after 24 hours?
No.
Nice. Oh, you say yes. Nice. You are doing that.
No, but when I was in orthopedic service,
Yeah.
The nurses usually start the rehabilitation in the infirmaries of orthopedy. They start the rehabilitation 24 hours after the surgery.
That's nice.
The question is, like Annabella said, some of them don't stay in orthopedic
Yeah.
services.
Yeah, I discovered yesterday that you have like some nursing rehabilitation services after the hospital discharge. We don't have this in Spain, so congratulations because you have at least this service. And the last one is, this is going to be for Andalusia because I'm coming from the south of Spain. It's a little bit more difficult. How many times of rehabilitation do we have for the patient with a hip fracture? What do you think? Red. Red, we have optimistic people. Green, we have 1 week of rehabilitation. In the best of the cases. So you know, people are receiving like 2, 3, or 4 sessions. They walk for some steps and go home. I don't care about you. This is the system in Spain. Okay, so now I'm going to explain why we created the ActiveHip Plus. It's answer to some of the questions that Glenn has mentioned before. It's because the incidence, the aging of the population, we are having more and more cases. Although the treatment is improving, but the number is not enough, so we are having more and more cases each day. Apart from this, we have a lot of consequences, and not only for the patients. I don't know you, but we are in Spain, the most of the responsibility of the recovery is going to lie in the caregiver, which is usually the family. It's not about the doctors, it's not about the occupational therapists, not physical therapists. It's the family who is going to be responsible of the recovery. And you can imagine the knowledge that they have about a hip fracture, nothing, okay? So they have a lot of complications, like for example, the loss of mobility, the loss of functional status. In the caregivers, they have a lot of anxiety, they have a lot of burden during this process because they have to deal with their previous life and with the recovery now, so it's much difficult for them. Apart from this, I have told to you, but we have a big lack of rehabilitation resources for this patient. This means that most of them are going to receive like 2 or 3 sessions and they are going home and they are not going to have rehabilitation unless they pay. They have to go to the private rehabilitation, okay? In Spain, I don't know in Portugal. And also, we have a problem because this project is going to be a little bit different from the previous one that we have done because we are providing them some educational program, not only about rehabilitation, but we are trying to make them informed patients. It's one of the main difference. Okay, so we have seen that they have a lot of health literacy about the rehabilitation, about the recovery process. So in this context, we thought, why are not going to try with mHealth? And this is why we created ActiveHip Plus. ActiveHip Plus is a project funded by the Horizon 2020 call, and we established a consortium between some of educational and hospital from Spain, from Portugal, from Lisbon, okay, and from Belgium. It is an educational and telerehabilitation program composed of a physical exercise and occupational therapy intervention, and it's delivered through an online platform. We have a web page for the health professional, and we have an online mobile application for the patients and for the family caregivers. In this case, the family caregivers are essential because we have 80 years old patients, so the use of the mobile phone, you can imagine how it is. Sometimes, you have a smartphone and they do like this, and they don't have a smartphone, they have like the old mobile phone, so we need the family caregivers in this kind of project, okay? So this project was born in 2015. It was like a very humble and small project. We started with a web page. It was a nightmare. It doesn't work, nothing. Like we have a lot of videos, but they were always loading. The patient were not able to do nothing. But even with this, we try to do like a pilot project with them. After the results, people in Europe, they thought, okay, maybe this is a good idea, so they funded again, and we developed this, like the mobile application I'm going to show you today. And in 2024, the status of the project, we have made, I'm going to talk about this later, but we have made a very big effort in the implementation. Not only we need papers, we need manuscript, we need implementation, and it's the result we believe more in this. So you can see how the hospital, we started in Portugal and in Spain only, and now we are in Belgium, we are in different places of Spain. We are coming again to Portugal, thanks to Ricardo, to try to implement this across Portugal. And one of the main differences of this project is not to focus only in the opinion of the healthcare professional, not only rheumatologists, not only orthopedic doctors, it's all about the patient. And we have done a co-creation process with the patient that have recovered a hip fracture, with their family caregiver, because we knew that they were going to be very important in this process, and with health professionals for sure. What we have done is to summarize their opinion, what do they need in an application, what type of contents they need, and after that we have developed all the things you are going to see in this slide and in the presentation. Okay? We have like an educational program, we have translated this in 4 languages, in Belgian, in Spanish, in Portugal, and in English. Okay? We have like more than 200 videos. You imagine how difficult it is to manage how many videos. We have an online platform I'm going to show you briefly later. And we have also some recommendation guide. It's in paper, but when we were with the patient, they asked for, I really like your idea, a mobile phone is very good, but I want some papers contents. Okay, there you have. We have also them in PDF, and you are going to have at the end of the presentation a QR code, so you can download every single content. Most of the contents are adapted, are translated into Portuguese, okay? So if you want like a testing user, after the presentation, you can ask for me, okay? So After the co-creation process, this is the main scheme or the structure of the ActiveHip Plus project. Okay, we have two main sections. The educational contents, we have contents which are common for the patient and the caregiver, and contents that are specific for the family caregivers. We know that they have to train them. It's not only about an informed patient, it's about also about the caregiver informed, because they are going to face the process and they need the enough amount of knowledge for this, okay? The other main section is the rehabilitation program, which is composed by a physical exercise intervention and an occupational therapy. And in the middle of the slide, you can see like there is a kind of education, kind of rehabilitation program. They have like some tutorial to perform some activity of daily living. We have some recommendations about the overall process of recovery, not only focusing on rehabilitation or activity of daily living, but for example, the nutrition, what kind of resources they have for this process. So we try to do like a comprehensive intervention. If you have questions, you can interrupt me, okay? Don't wait until the end. So this is more or less the educational program we have created. We have information common for the patient and for the caregiver, and it's going to comprise from the very beginning of the process of the hip fracture recovery. It's like, what is a hip fracture? What can you expect for this hip fracture? We are going to provide them information about what can you do while you are in the hospital, okay? Because you have to prepare your house, you have to apply for some support, whatever you need. We have some information for them about the first day at home. I don't know here, but for them in Spain it's like the critical moment. The day they arrive home is like chaotic for them, so it's very difficult and they need this kind of information. And after this, we have like the last two modules are more thinking on the prevention of secondary fractures. We know that about around 20–30% of these patients are going to suffer again a hip fracture, so we are trying to provide them some keys. And apart from this, we have like the information specific for the caregivers. We have two different modules. The first one is to teach them how to care the patient, okay? It's like, how do you have to leave the patient when he's in the shower, when he's in the bed, when he's in a chair. And the second one is for his specific health status. We know that they have to be in an overall more or less well condition of health to be able to take care of the patient. This is, okay, more or less, the rehabilitation program. We have like two different programs, the physical exercise and the occupational therapy. What we are doing is to provide them 12 weeks of rehabilitation, okay? As you can see in the middle, or in each one of the programs, we have like week 1 to 16. But we are providing 12. Do you think why? Is someone able to say why we have more weeks?
I didn't catch the question.
We have like 12 weeks of intervention for the patient, but we have recorded 16. Yeah, but we are providing them rehabilitation during 12. Do you think why? No? Okay. One of the main disadvantages of the telerehabilitation is that it's not personalized for the patient. It's like you have a solid structure, you are not going to modify anything during the process. So what we did is to have more sessions, more complex for them in case of them are evolving better. I mean, we have in the web page, we are able to adapt the rhythm of the rehabilitation to their functional status and the physical condition. So we know this is not perfect, this is not the best approach. We are trying to improve now with intelligent artificial, but we thought at least we have like some gap to improve them, okay? So basically the physical exercise session have a warm-up, a main part, and a cool-down, and they are focused on improving some conditions, for example, the balance, the speed, the walking, okay? And in occupational therapy, what we are doing is like to use home daily activities of daily living, social activities for them to improve their functional status and their social participation, okay? One of the main things is that the occupational therapy program is adapted to the patient in case of he has a prosthesis or a different surgery, okay? And these are more or less the resources between the rehabilitation and the education for the program. They have like three main sections. The first one is like about activities of daily living for the patient. They have also general recommendation that we have recorded with a nurse, with an occupational therapy, a physical therapy, a sports scientist, and a rehabilitation doctor. And we have also a specific section, not only in the education, but also for the caregivers in this kind of mix. Okay, so they have like some tutorial to help the patient during the activity of daily living, some tutorial for the back care, because it's one of the main symptoms. They have low back pain, and they have also kits for physical and mental well-being. And basically, this is the online platform, okay? So in the left, you can see the one for the health professional. For us, what we can do is to monitor the evolution of the patient in terms of the rehabilitation, in terms of the educational program. We can adapt the rhythm of the evolution for the patient, and we can also communicate with them. We know that this sometimes is difficult because you said, I have something more to do. I have to answer the patients, but it's something they demand a lot. They want to, not just to have a mobile phone or an application and be alone. They need that someone is there, okay? So they asked for this during the focus group, and it's something we have tried to implement. And here you have like the application, which is providing all the contents I have shown. I'm going to show you a very brief video about the ActiveHip Plus, a kind of summary.
The ActiveHip Plus program, a unique 12-week health education and tele-rehabilitation program. It involves patients and caregivers in taking an active role in the recovery process, facilitates digital medical care, and enables remote patient-to-healthcare professional monitoring and communication. Enables continuity of care between patients and professionals. ActiveHip Plus has a mobile application for patients and caregivers where they can find all the necessary resources for their rehabilitation program. In an easy and intuitive way, participants have access to the physical exercise and occupational therapy videos scheduled per week, with a questionnaire at the end of each of them for follow-up by the healthcare professionals. Direct access to the online educational program with specific modules for patients and caregivers. Patients and caregivers also have at their disposal a series of extra resources to complement and expand their knowledge from the scheduled rehabilitation sessions.
And well, regarding some of the results we have had with this project, what we have done is like a 3-steps process. We started with the analysis of this co-creative process, like with the focus group with the patient. We analyzed everything that they said. We have like tried to make a qualitative study, not only quantitative. The second one was a study of feasibility that was conducted between Spain and Belgium. We tried to do it here in Portugal, but when we started, we had problems with the COVID. So it was not able, people working in Lisbon, they were not able to recruit patients. Unfortunately, now is your time to recover the Portuguese time. And the last one was the randomized control trial. We have conducted this study from 2020 to 2022 in different hospitals from Spain and from the south of Spain and Belgium. And the inclusion criteria you can see there, but if you want more information, I don't want to take too much time for this. These are some of the studies in case you want to take a picture, in case you want to read. And this is the one we are most proud. You can understand why. It's like you see Lancet. It's got amazing for us. Like we didn't expect this when we started the project. We wanted to implement, but if this happened, we are not going to say no. So basically, the result of this randomized control trial was that this program improved more the physical condition of the patient and the basically functional status regarding like the activities of daily living, okay? These were the clinical outcome. As you can see, we measure a lot of things in the patient, like for example, the physical condition, the functional status, the quality of life, or the mental health. But we also measure things in the family caregivers. What we are doing now is to try to implement or to develop a program also for the caregivers, not only some videos by itself, a complete program for them also. And I'm going to finish this with the result we are more proud, because we started in a hospital in 2015, I can point, but here in the south in Granada, we started here. And for us, it has been amazing to be able to include more than 10 hospitals in Spain that are using in the daily clinical practice. It's not only about research. We made the research in 3 hospitals of this, but they are using this daily. So for us, it has been an amazing journey. And thank you so much. You have this QR code with the landing page of the project. You have my mail or my Twitter. If you need some information, I'm more than happy to give you. Thank you so much. Obrigado.